I'm Dr. Neil Skolnick, and today we're going to talk about the American Heart Association's scientific statement on the mind-heart-body connection. This is a great paper and really gives the modern scientific underpinning for what we all in primary care firmly believe, and what even the Greeks believed thousands of years ago, that a healthy mind makes a healthy body. Hippocrates said that as well. The article says essentially that the mind, heart, and body are interconnected and interdependent. I think all of us know that, and let's go over the evidence. First, chronic stress. Two different meta-analyses of prospective studies, over 100,000 people, showed that stress is associated with a 27 to 40% increased risk of coronary artery disease and cardiovascular outcomes. Social isolation and loneliness, 50% increase in cardiovascular outcomes. The mechanism that chronic stress does this through might be an increase in sympathetic tone, decreased vagal tone, increased arterial stiffness, and inflammation, all leading to endothelial dysfunction. Let's now talk about anxiety and depression. A meta-analysis of over 2 million people with anxiety showed a 40% increase in the risk of cardiovascular mortality compared to those who did not have anxiety. In a meta-analysis of almost 1 million people looking at depression, there was a 30% increase in the risk of MI and a 45% increase in the risk of stroke. Even chronic anger and hostility have been looked at. And this increases cardiovascular outcomes by 19% in healthy people, and in those who have had underlying vascular disease diagnosed already, a 24% increase in cardiovascular events. Studies have shown that there's even an increase in cardiovascular events in the 2 hours after an outburst of anger. So that's a reminder to be careful. And the mechanisms here include increased platelet aggregation, as, of course, an increase in sympathetic tone that can induce myocardial ischemia. There's fascinating data on pessimism suggesting poor outcomes in people who are pessimistic. How about the positive side of things, optimism? Well, there was a meta-analysis of over 220,000 individuals finding that those who have high levels of optimism have a 35% decreased risk of cardiovascular outcomes and a 14% decreased risk of all-cause mortality. The mechanism here may be more straightforward. Optimistic people tend to exercise more, eat better, and have more social relationships. They also, interestingly, based on a lot of those things, have a over 50% greater odds of living to 85 years of age or beyond. There's another trait that's important for all of us to know: a sense of purpose. 10 prospective studies have actually looked at this trait, over 130,000 individuals, and those with a greater sense of purpose have a 17% decrease in the risk of cardiovascular events and age-adjusted all-cause mortality. So we get the picture that emotion, attitude, social connection are all important to healthy outcomes. Other traits that have been looked at also associated with positive outcomes include happiness, mindfulness, and yes, gratitude. While the correlations and mechanisms are rock solid at this point, it's not clear that we know how to intervene. Studies of SSRIs, CBT, stress reduction have really been mixed with regard to outcomes. It's 45 years now since George Engel coined the term the biopsychosocial model of medicine and published his seminal article in the journal Science. We now all take for granted that we should approach people with a biopsychosocial approach. This article from the American Heart Association gives us detailed scientific evidence supporting this idea and the context of the importance of attitude, of stress, of anxiety, depression, optimism, all of this influencing cardiovascular outcomes. It's up to us to figure out how to use this information to help get the best outcomes for our patients. I'm Dr. Neil Skolnick, and this is Medscape.